Hi. What a wonderful movie. In case some of you might not know me, I'm C.S. Lau. I'm the moderator of this panel discussion. And on my right, we have Professor Leo Poon and also Dr. Hui-ling Leo, okay, from the School of Public Health of the University of Hong Kong. I must say, actually, the last message of the movie that says it takes all of us actually really moved me. I have actually seen this movie once before, an abridged version a few years ago when it was first released, also in the Asia Society. I felt pimples in my skin, and I tried to watch part of the movie again just before I came over this evening. And I felt really something boiling inside me, and I see it again now. And they're just really delivering some big messages to all of us. So it is really good that we have two experts with us today. And I also note many of you sitting in the audience are experts in public health, in virology, in microbiology, etc. That all of us, okay, will work together to help break those pandemics, to help prepare us better about all these pandemics that we have faced, and in fact, the one that we are facing now, the COVID-19. So maybe I should start by inviting our two panelists to perhaps first sum up, having just seen this movie now, and why is it that in the 21st century that we are so susceptible to pandemics? We have heard about the swine flu, we've heard about the Ebola, we've heard about, the Zika, and now we're in the midst of the COVID-19. What are the important, factors that make us so susceptible to these pandemics? So maybe I will start off with Leo.
Yes, I think there are many factors that contribute these. We have a regular attack of these zoonotic disease coming from animal to human, and there are many factors. And then, like for example, as the video show, the increase of international travel actually make a big a contribution to facilitate this disease to be transmitted between one country to another countries, right? And then the other is the change of farming practice. Now all these poultry, pigs, all these animals now being farmed in high concentrations. Even human now we live in a city, so we have to actually change our lifestyle a lot. So whenever these virus jump into animals, either in domesticated animal and then eventually get to human, we actually provide plenty of opportunity, to spread between animals and also to human. And the other thing that I think which is more critical is, we have more and more interactions to wild animals. Now, people now go to, maybe some exotic countries, exotic places like visiting bat cave or maybe somewhere else. And then they have seen a lot of, interesting animal which have never been seen before. And that provide opportunity for us to interact with these animals. And then they actually equally, like other animals, they carry viruses. And they may not be harmful, this virus may not be harmful to this animal, but it may be harmful to us, right? Then when it jump to human, we will end up having disease and maybe even spread to other individuals as well. Maybe, Hui-ling, you think?
Yeah, indeed, as mentioned by Leo, so there are human behaviors that created those opportunities for us to be in contact with the viruses much more often than before. In addition to that, because of this, there will be more chance for the viruses to perhaps adapt to a new host because of those encounters. We know that many of the spillover events usually do not lead to human transmission. But if such events get repeatedly, there will be a chance for the virus to get adapted, and perhaps that becomes more efficiently transmitted in humans or reassort, like the influenza viruses.
Okay. So, as you mentioned, actually, the viruses or microbes actually that got, passed from animals to humans. Okay. When I remember, hearing all those stories about the origin of SARS many years ago, and from the public health point of view, how do people actually, trace the origin of these microbes and viruses? How do we know that it actually comes from some animals and what animals, etc.? What are the sort of processes that go through public health people?
Yeah, so usually those events involves an animal, and perhaps the people have close contact with those animals. So usually they will be the first to have a disease symptoms, and then we can compare perhaps the sequence of the virus to see the correlations there.
Yeah. So now, as the video showed, 75% of these, zoonotic diseases are actually coming from animals, and this is a problem. Actually, we don't know how many viruses in animal kingdoms. And what we know is that maybe it's a bit of these and there in different species. But then, are they harmful to us? Most of the time, actually, we don't know. Even I worked with coronavirus for many, many years, and we don't know. Go back to the SARS event in 2003. There are a lot of people have different reasons. And I can tell you to some extreme. Some of the people think actually these are extraterrestrial organisms. So actually published in Lancet.
All right.
Our belief or not. So basically, a lot of speculation. But then I think what we need to do is actually do investigation, doing surveillance, right? SARS was detected in 2003, and it takes 2 years to find there's a bat virus similar to SARS. But in fact, it takes another 15 years to actually identify a particular region in China that have different virus sequence from bats that may have to make a genetic makeup that equivalent to SARS. So it takes many, many years. And so, it would be hard and for us to, try to give us immediate answer, hey, where this virus come from? We don't know. We just need to actually do more surveillance to understand this.
Okay. Indeed, actually, a question suddenly, gets on my head. And that is, we don't often, during the COVID and in the movie, actually, we don't see anyone interviewing the vets. Should we be working closer with our vets, our veterinary, colleagues?
Certainly, there is definitely a need to work closer to vets, and also also the environment. We should, the ecologists perhaps also need to get involved as well.
Yeah, I mean, there's one concept called One Health. Now we talk about human health. It's not only about human health. We talk about animals, environment, and in fact, like organizations like WHO, FAO, OIE, they actually now tend to work together because they understand human disease is not human disease only. Actually, other factors, including animals, will affect us. So, now we try to work as a multidisciplinary team with different experts so that we can able to tackle on a single problem.
Okay, that's very important, right? So, in fact, you've touched on, forming a team of people who will work on these potential pandemics, etc. So, what could we do on the whole besides, reacting to the occurrence or the discovery of a new infection? And how do we prepare ourselves?
I think, like the video said, again, doing preparation is far more cost effective. It saves more life. So I think we need to actually do a pandemic preparedness. But we have been doing it in the past, but the problem is it's not in full gear. Maybe due to other practical reasons like resources, manpower, and so on and so forth. But doesn't mean that we have to stop on this, and we have to continue to do that, right? So, WHO, for example, they regularly have the review potential possible pathogen that may jeopardize human health. We call it R&D, blueprint. So, they list out all the potential viruses or bacteria that may actually have a big impact to human, right? It doesn't mean that these will be the one that will affect us most, but then this will be a drill so that we can, for example, identify coronavirus. Actually, this is one of the lists at all time. So how can we detect it better? Can we do a better surveillance to understand the virus, the ecology in animal? Can we try to develop some antiviral vaccines so that we can able to address this problem whenever it comes to human? So we have been doing it for a few years, but then, of course, this is not enough. We still have a long way to go. But having a list so that we have at least a target to work on and act as an exercise or rehearsal. Whenever there's a real pandemic come, we can able to use the tool, like the vaccines. Now, it takes a year just to develop vaccines. So, if it happened in 2003, there's no way that we can have a vaccine like this so quickly.
Would you like to add anything, Hui-ling?
So another thing about prioritizing those pathogens is about risk assessment. So we now have surveillance, and we know potentially there are different animal viruses out there which can cause zoonotic infections in humans, and we should rank them based on their potential to cause a pandemic. But this is not oftenly done. So there's definitely a need that we should increase more research in that area.
Okay. So research is one thing, but what about, say, the government? What do you think the government should be doing? Local government, national government, across countries?
I think most important, I'm in this particular pandemic, I think communications, seems to be the most important issue. Because that will affect the trust between government, within the community, and so on and so forth. So how we disseminate this information in a timely manner, and how we can provide the facts, right, based on science, to the public, so that they can actually make their personal judgment. I think that would be very important. Right now, there are a lot of people, have a lot of misinformation circulating all around. Now Twitters, just mentioned it, and a lot of fake news, and people actually, now I think I like the lady, the comments or not. If you do a Google or do a search, you basically have 30 websites giving you 30 different answers. Which one I should take? which one I should believe? I mean, actually, sometimes some of these people would just want to believe the one that they want to believe. So that is the problem. So without knowing the fact in details, they can just try to, be emotional and try to believe in something that they think is appropriate. So I think what I'm saying is getting communication, effective communications based on fact will be very, very important in terms of public health.
Okay. Anything to
And
add? Hui-ling?
also, increased collaboration between countries. Disease has no borders. So,
Okay, right. Now, I've kicked off with a few questions actually for our panelists. We will open, the floor to all of you here as well as those online. But I will ask one more question, because I was actually, one of the very first few minutes of the movie, the narrator was saying that, in fact, during a pandemic, we don't feel safe. We don't feel safe, we lose trust. In a way, when we don't feel safe, besides losing trust, we also, because of the worry, the scare about, the pandemic, we sometimes listen to people. What I have observed in the last, say, 18 months or so since, the COVID-19, initially we didn't feel safe. We were very worried. We were, we hid ourselves, from other people. We isolated ourselves. But after some time, we all feel a bit fatigued. All these social distancing isn't what we want. We want to go back to work. We want to dine with our colleagues and with our friends, and we want to have social interactions, etc. And somehow, I think, in the last few weeks, we see that, with people being very eager to get back to the so-called normal life, we are seeing another, surge of the number of cases again. What can we do about, this fatigueness?
Right. I mean, for this COVID situation, I think my only advice to you to just be vaccinated as soon as
Yes.
possible. I think that is the biggest solutions right now, the practical solution to help us to revert from new normal to real normal. Right. I mean, this is important, and I urge the audience and for those in the internet, please try to vaccinate yourself. I mean, that actually there are many data, scientific data to show it is safe, effective. It helps you to prevent you to end up in severe clinical outcomes or even get killed because of the disease. So for me, I think vaccines seems to be at least right now a solution. You talk about radical control measures like social distancing, work at home, school closure, but we can't do that forever. I mean, our society need to get back to normal, and I think vaccine seems to be one of the solutions. Of course, it comes with a package. So.
Yeah, and it's not just protecting you, it's protecting people around you, just like the comment from the pediatrician in
Yeah.
the film.
Takes all of us.
Takes over.
Okay. So maybe I should actually open, the rest of this discussion time to the floor. Do you have any questions from the floor? I mean, since you talked about vaccination, I have many, many questions, but I will. Yes, the gentleman at the back. In the middle.
Yes, I think during the movie we were seeing the doctors and she was mentioning that exactly what you said. That's getting vaccinated is not just to protect oneself, but to protect the others who may have some weaker immune system. But I think, is it now established that, because why don't we simply, in your discussion with the government, force the government to make it almost like a civil responsibility, that to make the vaccines compulsory. We have to pay our tax. It's not a choice. Why cannot we just say that to prevent and protect the society and the economy in which we live, we should get vaccinated as a compulsory duty? Is that part of your discussion with the government, or?
Yes, like the smallpox, right? Vaccination campaign, right? Nobody was allowed to leave Tanzania actually until they have been vaccinated. What about nowadays? Can we do that?
Yeah, I think we are living in a very different ecology nowadays. So it's very hard to use this, forced people to be vaccinated. Everyone have their own free will, and then we have to respect them. But I think what we should do is try to, emphasize on the common good. So what is the benefit of getting vaccinated, right? Not only protect yourself, but also the community, help the society to get back to normal, right? I mean, still, at the end, I think it's very hard to, because of the personal right or human right, it would be hard to actually force them to be vaccinated unless the pandemic get out of hand, all right? Right now in Hong Kong, we only have today we only have a few cases, right? Only one local cases in Hong Kong. So, I mean, it's very hard for the government to, to insist on this. I mean, not talking about vaccination, the thing about the community test that we had last year, right? How many people actually commit or involved in this community test? Not that many. I mean, again, now it's very hard politically, to try to motivate these people to, I mean, if they don't want to do it.
Yes. Anything to add, Hui-ling?
It's
Yeah.
difficult.
It's just a difficult subject. I guess I think people have actually researched into the willingness towards vaccination, and in almost every city, every country, you have a percentage of people who are very willing to get vaccinated, and there are some who are not quite sure. And there's almost always a percentage of people who will never get vaccinated, but no matter what you do. It is the middle part of the population that we should be really working on, like what I think Leo has just highlighted and Hui-ling also highlighted too, by presenting them the facts, presenting them the truth, and then educating them, making people realize that this is not just for own personal good, but in fact the good of the public, etc. Yeah. And any other questions from the floor? Hi.
Hi, hey Zoe. I would like to ask, like in the video, and like you have mentioned that like in Google when we search, like we have a lot of information in the internet, like 30s, like some of them are like fake or some of them are fact, right? So how can we filter out the fake news? Like how can we choose the right resources we have to know? Like, what is your recommendation? Like, okay, for now, in Hong Kong, there is 2 vaccines, right? One is BioNTech, one is Sinovac. Like, people are like comparing the side effect of both of them, right? So, like, how can people like, decide which one they take?
Right. For me, I think what I normally do is actually when you do Google that, and then you find a lot of answers. But I would just think about actually who is actually talking about that. Do they have the the background expertise to speak for this particular issue? I very often have seen those lay people to talk about particular scientific issues. What did they actually? I mean, what are the references that they actually had to back them up? Sometimes when you look at that, basically this own personal speculations, personal feeling, and in that case, I mean, I would not trust those information. And on the other hand is, how often you encounter the similar conclusions from different experts or different website, right? So if the more people talk about it, I mean, I think I will have more trust on those information, right? And then, of course, at the end, it would be nice if you can actually go back to the original data, which can tell you what exactly is. Is it a credible journals? Is it a credible source from like WHO and things like that? And these will be the important information that I would normally take a reference for.
I think another possibility is for the government actually to set up, a particular group of people trying to debunk those rumors in a very rapidly and transparent manner. So communication is really essential, and rapid communication is important in that matter. As we have heard from Professor Larson, that actually those rumors, they will thrive when people are uncertain, and in particular, they really want an answer. So really, as Professor Lau was asking, what should the governments do? I really think this is, part of the things that the government should try to set up, to clarify those rumors, or even to set up some hotlines for people to call in, to clarify those issues, to answer those questions. I think that those will help, actually. Yeah.
I must say, actually, sharing a bit of local experience, of course, it is very, very difficult. And we've tried very hard in the last few months, and I must say we have not always been very successful. As Hui-ling and Leo just mentioned, it's important that we educate people. The government should set up all those things that have just been mentioned. But then, of course, unfortunately, I mean, we don't always have, trust of a government. So we really need people to work together. So we need to have people who perhaps the general public will trust to spread the news, to spread the facts, etc. So I think all healthcare workers need to work together to disseminate all the true information. We need people who are familiar, who the public are familiar with. I think even engaging the celebrities, for example, is important. We need teachers are people who others trust, the students will trust, etc. We need to educate the teachers to educate the students, etc. We need, also people who help us spread the news, spread the information, people who others will listen to. Perhaps I think the recent campaign being supported by some of the corporations will be useful. When the boss says so, some of us will listen. Okay, when the parents say so, some of the children will say so. So we need to educate all these people. And I think most importantly, I think what I've learned in the last few months is we really, really, really need the support of the media. I think we have, you probably agree with me that, in fact, I'm not suggesting that the media had not been supportive, but then the way that some of the events were reported had really caused a lot of mistrust in the public in the initial phase of the local vaccination campaign. But I think recently they have been a bit more supportive, and then we can see there's, the surge in the number of people wanting vaccinated. So it takes all of us, once again. Hi, Professor Lam.
Yes, I work basically in tobacco control, all right? When I was a medical student 40, 50 years ago, the professor lectured and smoked at the same time in the lecture theater. And we think it is impossible to get the professor not smoking in the lecture theater. Everybody will say it is impossible and difficult. And 30, 40 years ago, we say we don't allow smokers to smoke right here. And you will say it is difficult, impossible. Right? So saying something difficult is certainly true. But I would like to cite our late Professor Tony Hadley said, who was previously the head of our department. He said for public health, what are the three most important things? Number one, legislation. Number two, legislation. Number three, legislation. All right? Of course, we need to do a lot before we can really have legislation. Right? But I think if we want to tackle the problem of vaccine hesitancy, communication is important, but not enough. We need really to move forward in some way that it has to be done mandatorily. For example, in the United States, in the hospital, doctors are not allowed to work if they don't vaccinate for flu. That's it, finished. No human right. This is not just human right. Public health is not human right. Let's remember that. Right? So I think, are we too weak? Are we afraid of people who are spreading misinformation? Are we afraid of people who keep on saying, I don't want to vaccinate because I have my freedom? Do we just yield to them too readily? And without pointing our finger at them, saying that this is irresponsible. I think if we are just being weak in terms of public health, this is not going to help the problem. We managed to ban smoking in all indoor places in 30, 40 years. Tell me, in the next 30, 40 years, before I become 110 years old, all right, can we have some kind of real solution on this vaccine hesitancy, given that we have the most effective vaccine in the world? And if we keep on respecting all this so-called human freedom, just like the example in the movie on the smallpox, right? And if that gentleman did not make the decision of going to do that, we may still have smallpox today. I think government is too weak. Of course, it may have some other problem. Some governments are very strong, but they will go into the wrong direction. Whatever. And I have heard that there are already some people advocating for a framework convention against pandemic. We need an international law. Just like tobacco control, we have an international law of framework convention against on alcohol, on tobacco control. So that is a major step forward. We not only need legislation locally, we need legislation internationally. And I hope we can somehow push this forward. At least, if we cannot do this next year, maybe 30 years later. But we have to move that direction. Communication to people who just refuse to listen, or for whatever reason, is not useful. And you only allow them to keep on spreading and behaving like viruses themselves. As you know, these people are very strong viruses. They can spread misinformation, they can spread everything. All right, thank you very much.
Thank you very much,
Can I
Professor
comment on
Lam.
that?
Yes, Leo, please.
Right.
you have to
I
respond.
absolutely agree with you. I mean, I would glad that if we can vaccinate all the people in overnight. But then the reality is we live in a world with different cultures, different backgrounds. And I mean, I just give you an example. I'm like the MERS event, and I went to Middle East and talked to a couple of ministers in different countries, and they have a diverse, very different view on MERS. We know that it's coming from camels, and some of the countries like to vaccinate the camels, some don't. And the problem is different people or different governments have different views on a particular issue. It will be very hard to have a united view overnight. Actually, I've spent a week to talk to them, and we just come up with some agreement, which is minimal to me, but it's better than nothing. So what I would say is right now, we may not able to make this as a legislation in Hong Kong, but then we can at least try to educate them and guide them to be vaccinated, right? And if you force them to be vaccinated overnight, and I think there will be a lot of resistance.
Okay.
If you keep on educating these people, the 70-year-old girl, the 27-year-old gentleman, and then the lady living near us in Aberdeen, you expect more Delta coming up. These people won't go vaccination, regardless of your education. Simple. If you work in that country, you don't vaccinate, go home, no job. Finish.
Thank you, Professor Lam. I think this is a very strong message. In fact, we were also discussing this morning, actually, and in the afternoon, in many of our WhatsApp groups about, enforcing and mandating people to get vaccinated. So we do need to be stronger, and I think governments need also to be united as well. That perhaps brings me a question, and that is whether, about the role of the WHO. I see we have a few colleagues who have worked in WHO before. Should the WHO have a bigger mandate in, advising the international community on, say, for example, vaccination? Maybe may I invite KG to? Professor KG Fukuda.
Yeah, so I think it's good for everybody to think about WHO in two different ways. You have an organization, which is what everybody sees, and so the Secretariat in Geneva and all of these things. And this is the organization which convenes countries, scientific experts, and this is the organization which puts out recommendations. And so Leo and Hui-ling work with them on influenza vaccine recommendations and so on. But the heart of WHO is not the organization. The heart of WHO are the countries. They are all members of WHO, and that is what is hard for people to really understand. And so the strength of the multilateral agreements doesn't come because Geneva says we have an agreement. It comes when countries say, we believe that we should work together. Because if countries don't agree to that, it doesn't matter what the agreement is. So I don't think at the international global level you can mandate anything. If a country says we're not going to do that, you are not going to send an army in, you're not going to put a trade embargo on. And so it does come about that if you don't have countries saying that we want to work together, we want a multilateral approach, none of these agreements have teeth and none of them have power. It all comes from a kind of joint willingness to work together. This is probably the outstanding observation about COVID, or one of them, which is that cooperation in many ways has broken down. When I look at it compared to some of the earlier large outbreaks and pandemics which have occurred, there's kind of a stepping back that we have seen with COVID, and it's one of the most disappointing things. In the discussions about the potential international treaty, the hope is that this will be a reaffirmation that there would be a kind of multilateral agreed approach, that countries do want to work together again. We'll have to see what happens. But that's really, I think, the take-home message. The power of the agreements does come from countries saying that we will abide, we will work together. Without that, the agreements don't matter. James?
Thank you, KG. Hi.
Hi, I'm just going to add a few comments over there. I mean, what Professor Fukuda said was absolutely true. And if you imagine the WHO as that logo and as that secretariat building over in Geneva, but it's really the 193 member states who, through political decisions, through development, through funding, through priorities, who steer the course of this organization. So I think what we've seen over the last year and a half has been a demonization of a family of technical experts who in the past couple of years have been shifting over towards seeing their work not only as technical health experts, but also as humanitarians as well. And I suppose it's naive to say that politics should be kept out of global health, perhaps as already very much by the nature of it, at the seat of it. But the politicization of global health has been pretty shocking. And what will be interesting to see now, after the G7 Leader Summit in Cornwall a couple of weeks ago, will the 7 advanced economies of the world that promised in their communique to strengthen global health systems actually take the first step by funding the World Health Organization to a level where the WHO can actually execute the mission that it's been mandated by its own member states. It is operating on a very, very small budget. The world is expecting it to do an A+ job with a D- budget. I think it has something similar to a budget of the University of Geneva hospitals. I mean, it's pretty shocking. And what we've also seen with individuals who've come under attack in the organization over the past year and a half, men and women who have given their lives, who have taken the Hippocratic Oath, who have committed themselves heart and soul. I think it's been pretty shocking what we've seen over the past year. And I think we also saw in this city as well. And I don't think anybody can walk out and say that they're proud of what happened, because that in itself allowed the rise in populism and inward thinking that we saw politically to take off like a virus in itself.
Thank you. I think this is another very strong message, and that is, we hope. I don't know how many of our state leaders have watched this movie. We should really be screening this, to these people. Is this a signal that our time is up? Oh, no, beg your pardon. Okay, we have a comment or question from the front here.
Yeah. Well, I don't work in public health, and having watched the movie and seeing that this is not the first time it has occurred, I mean, whoever's working in public health definitely deserves an F for the past and what we have currently seen. This comment, I mean, I'm a citizen of the world. This comment is not directed at the Hong Kong government, but really at the world leaders that's sitting, at the UN level or wherever that they're sitting. It is really disappointing to see that at our doorstep we have diseases like this that has occurred over and over again, and we don't have a solution, and we never learn from it. There are failures at every level of, from local domestic public health all the way up to the UN level. So, the gentleman there said, yes, we have limited resources, we have constraints here and there, but there are things that the world has come together to solve, like climate change, right? So we have the Paris Accord that has, garnered support from countries around the world to fight a common cause. So why can't at some point, I know it won't be tomorrow, but there is a common enemy that the world faces. And if the governments around the world can align themselves, the resources and all, I'm sure we can do it together with, whether it's a public policy that's required, whether it's legislation that's required, but a lot of this has to come from top down rather than coming from hoping that to become a reactive event like what we have seen over and over so many times over. So I hope, thanks for having this very, very interesting video. I think, as correctly you said, Professor, we should have more people, especially governments, to look at this and really start to think about, what we should do going forward. Thank you.
Yeah, thank you very much. Another very well said
Right.
comment, I think.
Can I say
Yes,
something about
please,
it? I mean,
Leo.
I think yes, but we do make an impact. Put it this way, I mean, I'm not speaking for public health, but actually we did have some impact in the past. We eradicated smallpox, right? The vaccines that we have now for flu, for measles or mumps, and then for polio, right? I mean, when I still remember when I was young, I can still see some patients with polio. But now, I mean, you talk to our kids. Did they ever see any polio patients, right? So I mean, we are improving our standard, and let's have some hope, right? We have some successful story, and now the reality is we are fighting against the mother of nature. There are a lot of viruses in animal. Eventually, they will jump to human, right? This is something that I would say is unavoidable. Of course, we will do a lot better if we have more, the government work together. We have the scientists or the public health practitioner have more resources, right? But again, the other thing is we also need the general, not the government, but also the general public work together. Like now we have vaccines available. Now, a lot of people would not like to be vaccinated because of various reasons. So, I mean, we are not only just pinpointing, hey, the government, WHO should do such and such and such. But actually, as a community, all together, we have to work together.
I
Thank you.
also like to say a few words. I think a pandemic that has been averted, you will never know. There have been a lot of efforts actually in the past years on influenza, I would say for sure. We've done a lot of pandemic preparedness on flu. So perhaps today we have not yet have another one because we have successfully averted it. Yes, indeed, we failed for COVID-19. But in many other diseases, preparedness we've improved. Perhaps you know that in 2021, we have new Ebola outbreaks in Africa, in different countries. Those outbreaks are now closed. They were only small number of cases, and we are now doing much better than a couple years ago. So we can learn from our experience and we can do better from those things. So I would say still try to keep a positive attitude for future. Yeah.
Thank you.
Let's,
Thank you.
have some hope.
Yes. Okay. I've been actually seeing signal that we should really be ending this discussion session, and in fact, I noticed that I have overrun the whole program by about 10 minutes. So I think we are going to have Alice to say some last words.
Thank all three of you, and I want to again thank Professor Roberto Borzone. Thank you for the collaboration with Hong Kong U-Pasteur Institute and our wonderful, Dr. Poon, and who's and Dr. Yen, and of course. All three of you for this wonderful discussion. Professor Poon, Dr. Yen, and Professor Lau. We will continue to bring programs like this, long as COVID's around, to really illuminate the subject. I think we talked about it, the more information, the better, and the more information directly from the source is also really one of the best vaccine for the misinformation out there. So again, thank you all for joining us. Thank audience online, and again, have a wonderful evening. And I know I think what I like to think is we're almost out of the wit. Vaccine. One of the things I echo the thinking of the positive. Think about it. In less than a year, I remember our first program that we did in February of 2020 with Professor Van Cowling. And at that program, he said, oh, yeah, it's going to be another few years, about 2 to 3 years to get the vaccine done. And, look at the world, we got it done in less than a year. The challenge now is to get everybody vaccinated, or as many people as possible. So I think I want to thank all of you and all of the public health officials out there. There's still a lot of work to be done, but at least I think the community, we are here together, and we're going to support each other through this next couple of months. Hopefully, it's not going to be another year, but regardless, I think we've come through so far this year and a half, and I'm so proud of those of us here in Hong Kong. Yes, there's still a lot to be done, but you guys have done a wonderful job, and as I've said many times before, we have so many heroes in this fight. And it is not over yet, and we will have more heroes. And again, thank you for the collaboration with the Hong Kong U-Pasteur, and good night, and have a wonderful weekend. Thank you.